lymphatic cluster is if you've had a lymph node biopsy, radiation in that area, surgery, those lymph nodes might not now be able to take on the full lymphatic demand of that quadrant. So many of you have had a lymph node biopsy in one of your axillary clusters. So the work that I want to do is to be able to help redirect that flow in sessions to a lymphatic cluster that can take the demand. So your axillary lymph nodes in the armpits. We have the sternal lymph nodes right in the sternum, so we direct from the nipples towards the midline. We have our inguinal lymph nodes right at the crease, where the legs attach to the torso. Okay? So right there, that kind of gives me my roadmap, and that's the very first thing I work with clients is let's identify where you've had work done, how we can now support your system. Okay? And it's crazy if you're even just having edema now in the hand from having a lymph node biopsy. I want to route that all the way across to the midline and to the lymph nodes to the other side. And we call this process lymphatic anastomosis. Okay, any questions there? Like, I'm happy to answer questions all day. Okay. Okay, so just give you guys some ideas as to why we might have compromised lymphatic system. There are certain infections that can compromise lymphatic system, cellulitis, this one always falls out of my brain. I'm just going to skip it. It's right there. MRSA. Traumatic events can affect the lymphatic system. So having trauma, injury to the lymphatic vessels or lymph nodes. Lymphatic capillaries and vessels are pretty good at regenerating. Lymph nodes are made out of reticular fibers, which are really fragile fiber. They can sometimes regenerate a little bit and heal, but sometimes they can't. Okay? And one thing to keep in mind when they do those lymphatic or those lymph node biopsies, often those lymph nodes are being fully removed to be biopsied, not staying within the body. Okay, so scar tissue from trauma, so like burning scar tissue or even surgery, incision lines can affect lymphatic flow. Cancer can compromise lymphatic system from those lymph node biopsies, lymphoma, radiation scarring, and surgery. We also have obesity can have effect on the lymphatic system when the adipose tissue is causing extra pressure on the lymphatic vessels. And then there are a variety of like genetic or hereditary conditions that can affect the lymphatic system. We're focusing on this section today. Okay, so one thing I like to talk, yes?
What's your feeling on deodorant that has aluminum in it? I've heard everything. A lady told me to put bay leaves under my armpits, or I'm like, what? And she's like, well, bay leaves and lavender.
Well, I'm going to say that, like, what deodorants are safe or not safe is definitely outside of my scope of practice to give a recommendation on.
Okay.
I would say that sounds like something to go Google and, get a feel for what you're comfortable with, but that's something also my clients will learn from me often. I'm not going to give you medical advice outside of my scope, so sorry.
Well, they say, and I'm like, who are they?
I think that's great for our Mythbuster. Who was that? Kim. Do a myth busting on that. Okay. So things to keep in mind once you have had a lymph node biopsy or a mastectomy or your reconstruction. Things to do to protect that quadrant that you have had affected. And I want you to keep in mind that quadrant is from like the belly button up to the clavicles, all the way to the fingertips, front and back, okay? So whichever quadrant you've had affected, we want to keep in mind tight jewelry in that area could cause some triggering of some increased edema. And I think almost everyone in the room has a goal of any edema not turning into lymphedema. So we're staying on top of that edema, staying on top of the swelling. Okay, elevation changes. You might not have thought about how elevation changes can affect your lymphatic system once it has changed. Okay, so I tell my clients, get good compression wear. Our compression ladies aren't here today, are they?
Yeah, feminine forms.
See, Vanessa is a good example. Get good compression wear. Even if you're just driving from Orem to Sundance, wearing compression wear can really help be preventative of having a swelling episode happen. Every time you fly on a plane, please wear your compression wear. Driving down to St. George. I just drove 2 hours down to Capitol Reef a couple days ago, and I had stitches in my finger. And I was so surprised at how much edema kicked in with each of those little elevation changes going through central Utah, okay? And that was for a finger with 2 stitches. I cannot imagine a large compromised area, okay? Hot tubs and saunas. So the lymphatic system its entire job is to pick up and move what we call interstitial fluid. That's your swelling, okay? Anytime we are exposed to heat, the circulatory system is going to kick up, right? We're getting more blood flow, which creates more interstitial fluid, which creates more swelling to be wicked away by the lymphatic system. Once you have a compromised area, we do not want to be exposing that to excessive heat. Okay, so as much as you guys might adore hot tubs or hot saunas, stuff like that, if all of a sudden we're putting an extra demand on an area that's compromised, we don't want to overload that system to the point now that we might be at lymphedema risk. I've talked to ladies that it was 1 hot tub that tipped them over. Okay, yeah.
So is there like a minimum amount of lymph nodes that have been removed that this would be applicable to? Like if you
Just one.
Dang.
Yep, I think this is all the training I've received. As soon as 1 lymph node is been removed, we fall into the category of lymphatic compromise, and we want to do everything we can to be preventative. Okay. So hot tubs and saunas is a good thing to be very aware of. They're fun, okay? But the risk can be too much, okay? Tattoos, something to keep in mind. A lot of my clients, we talk about like it's exciting getting at a point in their recovery to get some cool tattoos to cover up the scarring. Make sure that you are on top of your swelling, your edema, you're getting your, what do you call, LDEX scan, that you know that your levels are good before getting a tattoo, because lymph nodes are going to clear out the system post-tattoo. They find cadaver lymph nodes from people who have received tattoo contain tattoo particles and ink particles in them, okay? I'm a big nerd for tattoos. I love tattoos, but you want to make sure that your edema is managed before you choose to go get any cosmetic tattoos done, okay? Informed massage therapy, that's my biggest soapbox that I will stand on for you guys today. If you have compromised lymphatic system, you do not want any run-of-the-mill massage therapist working on your body. You need an oncology-trained massage therapist who knows how to adjust, and this isn't just during cancer treatment, this is the rest of your life. You need a massage therapist that knows how to adjust technique, pressure, stroke direction, and any other application to not compromise your already compromised system. Okay, we want to keep you safe. I want you to keep in mind Utah has passed a law now for massage therapy assistants. These are the minimal amounts, like 200 hours of education required to start, for those therapists to start laying their hands on clients. So be careful with who you choose to have work on you. Especially if you're getting massage, hot stone massage therapy, shouldn't be using hot stone therapy within that compromised system, as well as even like hot towels and other heat treatments or aggressive work. Okay, we don't want to cause extra demand on that area. But my clients can tell you, you can get really good massage care by someone who knows how to do that, okay? Blood draws and injections. So keep in mind that area. Ask your doctors, your nurses to do your blood draws, your injections on your other side, as well as blood pressure cuffs, okay? Instead of putting extra demand on that side.
What if you have both sides?
If you have both sides,
They can take your
talk to your
blood pressure and your
oncologist
calf.
and see what they would recommend.
They can take your blood pressure and your calf.
Calf blood pressure? No. I don't ever take blood pressures, or else I would have a better answer for you. So I'm going to direct you to your doctor on that one. And then also even like sunburns and bug bites. Even getting a sunburn creates an increased lymphatic demand on an area. So do your due diligence if you're a sunblock person, or if you're, long sleeves, wear your bug repellent, because it would be so lame for a mosquito bite to be something that puts you in a a state of edema that was more than you were planning on. Okay.
Can I just comment on the blood pressure? And
Yes.
Sometimes people kind of freak out if we're going to do blood draws or blood pressure tests on the arm. And we do try to avoid it, but if
Sometimes
your health requires that we do it, then we do it. It's a fairly low risk every time, but it is a good idea to avoid, but it's not like
it's not going to
you
be
can't do it.
exactly. It's just one of those modifications that are easy to make most of the time, but you have your
But if
professional.
you have to, you have to do it.
Yeah, if you have to do, we want to keep you guys alive as much as possible. Right? Yeah, and if like you're in an emergency situation, of course, get the care that you need to be, to stay alive. Okay. Okay. So things that you guys can do at home to support your lymphatic system. There's a lot of things. Like I said, compression wear. I'm a big nerd for compression wear. Like I don't have a compromised lymphatic system, but I wear compression leggings every time I fly. There's lots of really great compression wear out there. If what you have is making you miserable, keep exploring what is out there. Okay, go to Feminine Form. Those ladies are very, very helpful. At-home lymphatic massage. There is a lot out there. I'm going to put some resources on my website of some at-home lymphatic massage that you guys can do. I'll get those up in the next week. And also, when clients come in, we talk about what at-home lymph massage looks like for them that's custom for their lymphatic system. I've had some clients where we've made videos in the treatment room of what they can do at home. Exercise. Exercise and movement is one of the great ways to increase lymphatic flow. Our lymphatic system doesn't have a central pump like our circulatory system has the heart that pumps it. The lymphatic system doesn't have a central pump. The main thing that moves our lymphatic system is movement. Okay, so when we move our body, it helps move lymph. Also, those lymphatic vessels do have a single smooth muscle lining that does give a little bit of contractions throughout the day. Breath work is another good way to move lymphatic fluid. And then that manual lymphatic drainage. But exercise is great, okay? And I know sometimes some of you probably think like exercise feels absolutely impossible right now. That's totally okay. Even just walking around your kitchen 5 minutes is better than nothing. And it's not like I'm saying you need to get on a treadmill and run. Just basic walking, basic movements. Just keep the range of motion going. Dry brushing is an easy way to work on your lymphatic system. When we are doing lymphatic massage, we don't work into the muscle layers. We are just working skin layer. Simple stretch and direct of the skin. So at home, dry brushing is a really good way. It seems like it's not going to do anything, but it really does. It's just very gentle work to move the lymph. Okay? And then rebounders, so little trampolines, doing a little bouncing. The lymphatic system loves little bouncy movements. Any movement that you see that like shakes the skin is going to help lymph flow. And if you don't have the energy to get on a little trampoline and move, you can just sit on a yoga ball and do gentle bouncing. Can help move lymph. As well as shaker plates. Shaker plates are great, just on a very low setting. You don't need to do more than 5 minutes to get that gentle vibration. Can help with that flow. Yes?
Can I just add, there were studies with Beamer and lymph.
Yeah. Yep, Beamer is helpful for lymphatic flow.
What's Beamer?
So Beamer are these mats over here. I don't have expertise on Beamer, but this Cindy's your lady.
Come try it. It's fun.
Okay, so a question I get often is, when is it a good time to come and start seeking out care? Like, what are those triggers of, should I start getting lymphatic massage, or am I good to still wait? I suggest post-op is a great time to start. Post-op lymphatic can help reduce swelling right away, reduce bruising. Within a couple sessions, we see bruising start going down significantly, help with the pain management. I love post-operative lymph because it's also starting to increase circulatory flow as well. So we're moving lymphatic fluid, and we're also getting fresh fluid to that area. Post-operative lymph also helps with scar tissue management because we're taking the pressure off of those incisions so that they can heal without so much demand on them. Post-op, we also see it improves skin texture and tone, and lymphatic helps increase immune system response. So we get those increased lymphocyte production during lymphatic massage. If you start experiencing pain in that quadrant that has been affected, so if you are feeling pain in the muscles, even just pain in the skin, often around the elbow or in that medial part of the arm, or even increased pain in the joints is a good sign to start coming and getting lymphatic massage. And of course, swelling. If you're getting that unilateral swelling, you're noticing that arm is now starting to get bigger than the other arm, come in. Let's drain it. Let's get measurements. We do measurements with all of our clients so that we have a baseline of where you came in, and we try to find out where your plateau is so that you can stay comfortable and we can keep that system managed. Yeah?
What about the pain in the arm after you get your lymph nodes removed? Like, I wasn't more that this backside just gets numb and painful. I just assume that's a nerve.
Yeah, it can be some damage to the nerves, but it doesn't take that much lymphatic or interstitial fluid buildup to start signaling pain. And it feels sometimes just like in the skin, in the tissue there, some lymphatic drainage can get that pain to start calming down. Yep. Okay. And on to questions. Any other questions you guys have or details you want to go to? You can come over to my table. I'd be happy to answer any questions that you have. Yeah.
Sometimes I get pain under where I have my scar when I had my nodes taken.
Yeah.
Is that swelling?
It could be swelling or it can be nerve damage from it. We can do scar tissue work to help loosen that up. I've noticed a lot of people, once we start doing scar tissue work, pain decreases pretty quickly and that tissue starts softening up and we get better flow through there. Yeah. Yeah.
It's been 16 years for me.
Oh,
I had
that's
lymph nodes removed.
Mm-hmm.
I don't seem to have any of those issues. Like, I go in a hot tub, it doesn't affect me or anything. Would it still be helpful for me to come in and have a massage?
I'm always here to see if it's helpful for you and to give it a try. Yeah, you can give it a go. And I found with scar tissue, it's never too late to do work with scar tissue to get some softening, increased range of motion, better fluid flow. Yeah. Yeah.
So if you have both quadrants that aren't working, does the bottom part of you help?
Yeah.
Okay.
So we'll move stuff up to those lymph nodes in the neck as well as to the inguinal stem. Yep. Okay. Awesome. I appreciate you guys so much. Thanks for listening to my